Dr. Miguel Stanley is a globally renowned dentist and visionary in the integration of both oral and systemic health. Now, he's the founder of the White Clinic in Portugal and co-founder of the Slow Dentistry Global Network, combining his expertise in advanced implantology, prosthodontics, and aesthetics. Now, Dr. Stanley's pioneering work in AI diagnostics highlights his dedication to addressing chronic oral inflammation, which is linked to over 22 non-communicable diseases, which really transform the dentistry into being a cornerstone of healthcare and longevity. So, Dr. Stanley, thank you so much for joining us today.
Thank you, Phil. I'm super excited for this conversation, and thank you for highlighting such an important topic that goes many times overlooked.
Well, Dr. Stanley, I'm a Brit, and you know the Brits are pretty renowned for their bad teeth, so there's a lot of outdated dental work out there, right? And obviously that is contributing to chronic inflammation. So what are the risks to systemic health from that?
Well, as you said in the introduction, that there's over 22 non-communicable diseases that are directly correlated to the mouth. What does that mean? That means that, first of all, a non-communicable disease is one that I can't catch from you, all right? So, and some of these include Alzheimer's, and, autoimmune diseases, fibromyalgia, all of these illnesses. I think we need to just step back a little bit and understand why we're not seeing this. And it's a very old problem about 200 years ago where we separated dentistry from medicine. Has anybody ever stopped to think, like in the UK, why have you got doctors and dentists? And this is a global phenomenon. We pretty much were separated 200 years ago with two different ways of being taught and just never spoke to each other again, leading to this fallacy that the mouth is separate from the body and that your teeth are something to be used like jewelry or as aesthetics or like your hair or your nails that you can play with without impact to your overall body and longevity. And that's completely incorrect. So much like our diets, and if you look at the $1 trillion food industry, that's changing in a way to say, hey, is this organic? Is it biological? Is it GMO free? Is it free of pesticides? We need to start thinking about dentistry the same way. Is my dentistry, not just my teeth, has the dental treatments that I've had done in my life, are those impacting my health? So, a great podcaster like yourself, Dr. Huberman, spoke about this about 8 months ago. He spoke about the oral biome and all of those biohackers and longevity and wellness experts out there, which is a massive growing trend. And that's why I love your podcast, by the way, is that, we're talking about oral biome, but that's for healthy people with relatively okay teeth. So what are the number one things that people think about? They think about tooth decay, gum disease, right? But no one's really looking at old and outdated dental treatments, which is my focus.
Right.
And what happens when you have that in your teeth, people forget that your teeth go through the gum into the bone, and that bone is literally your skull. And your teeth, the tip of your teeth at the top teeth are literally millimeters away from your brain.
Right.
And your bone is part of your immune system. So if you've got an infected tooth, that literally means your whole body is poisoned. So your teeth have a huge impact in your wellness, your longevity, your immune system. And if the quality of your dental treatments is not good, if it's outdated or you haven't taken care of your teeth, the impact is huge.
Right. So yeah, I'm a child of the 60s, right? So I've got my 1970s filling still at the back here. No root canal for me, but I guess that this is an amalgam of really all of these old therapies coming through and potentially poisoning my body and many other millions of people, right?
Well, yes, that's the answer. Mercury amalgam fillings are literally 50% elemental mercury that keeps them liquid in order to help us prepare. This was invented over 100 years ago. It's hugely toxic. Mercury vapors go into the body, stored in the thyroid, in the brain, in our tissues, in our organs. The data on this is absolute. Thankfully, most modern clinicians will not use a mercury filling in a modern setting. Why? Because it doesn't look nice. People want things that are more pretty. But the truth of the matter is you've got a huge amount of Gen Xers. I'm a Gen X like yourself. And baby boomers that have their mouth filled with these lead mercury fillings. Maybe one your body can process, but if you've got like sometimes up to 10, 15 of these in your body, that compounds and you're releasing those mercury vapors. There was a lot of people saying no, for many reasons, because change is difficult to accept. The same way people said that pesticides are not bad for you. Glyphosate in your food, it's fine. Spray that stuff because it's good for the yield, it's good for the crops, but we know that it's bad for you. So there's always going to be two sides of this discussion, those that really don't care about it. But if you actually do care about your overall well-being, mercury fillings are bad. I've been a mercury-free and mercury-safe clinic for 25 years now.
Okay.
And if you do want to take them out, there's a very specific protocol to do that so that the vapors also aren't breathed in. And you
that's
should.
Interesting. Well, I'm interested to learn more about that, because even just speaking with you now, I'm thinking, wow, I've got to get myself booked in and get rid of these bad boys at the back here.
Yeah. And, in the UK, depending on where you are in the world, I'm actually British. I'm a GDC licensed practitioner. I've never practiced in the UK, but my mother's English. I actually think in some, I don't know about the legalities, but I think dentists are not allowed to say it's bad. I'm not certain yet. And there's some legal issues there because on the NHS, it's a very affordable and cheap material that mechanically is amazing. And if, throw aesthetics out of the window, it's fine. But it is a well-known toxin, and mercury's bad everywhere except somehow in your head.
Okay, yeah, I get it. Well, let's leave the legalities to one side. Let's talk about what happens with the immune system, right? Because, immunology is a huge part of longevity. I mean, we're all kind of defending ourselves against all sorts of toxins all the time. So what does this do to the immune system? You mentioned going into the bone. I mean, obviously that's, getting directly into your T cells, right?
Excellent. So regarding the filling materials, so that's say in the crown above the teeth, and there's a bunch of different materials. I would ask your listeners, if you're looking at having fillings done, go for BPA-free composites. So that's bisphenol-free composites. There's a few brands that do that. And don't be scared to ask for your dentist, hey, and you'll be surprised, a lot of dentists actually don't know, but you go for BPA-free restorative products. But the biggest problem isn't in fillings. It's inside the bone. So you don't necessarily have to have had poor quality dentistry to have this problem. I'd say the most common would be an infected tooth that hasn't been treated. Like, for example, an impacted wisdom tooth that's half in, half out, and that bacteria has managed to seep in, and you've got a huge host, like a cave of infectious bacteria, pathogens, fungus, all of that, and it's trapped inside the bone. Now, strangely, 99% of the times this causes no swelling, no pain, nothing, and it's there infected. This is directly causing cytokines or chemokines, inflammatory biomarkers that are directly released into the bone, into your immune system. And according to the work of Professor Edward Bullmore, the head of neuroscience of Cambridge University there in the UK, who published a book called The Inflamed Mind, he proved that these chemokines and cytokines can pass the blood-brain barrier. So it's not just an immune response, it's a neurological response. Yeah. And of course, in the jaw, you have a huge nerve that's directly connected to the brain. So if you have any of these low-grade chronic infections inside the jaw associated to old root canals, infected teeth that you haven't taken care of, that are causing you no local pain or problems, that can go into your problem, causing immune response, a negative one, and a neurological response that could translate as chronic fatigue, depression, anxiety, panic attacks, all the way up to dementia. So the importance of having a not healthy microbiome, that's secondary. Yeah. No infections in your jawbone that only a dentist with a CT scan can actually truly diagnose is of paramount importance. And I would actually argue, and I'm pulling things to my field, that it's probably one of the number one indicators for longevity. If you have low-grade chronic infection in your jawbone, your lifespan will be shorter, period.
Wow. That's
and health span.
So let's talk about let's assume that there's somebody young, they're watching us today. They don't have all of these legacy issues, but obviously there's a lot of people that do. How do you track the systemic transition that happens out of this? How do you track the fact that you've now gone from one older state to a new state, and you've got this biocompatibility reintegrated into your dental work? I mean, that's really important, right? That you can see that actually you spend a lot of money getting this stuff done, and you're now being able to move the needle back to where it should be.
Yeah. So I would argue that you're talking about somebody, for example, that was overweight, unhealthy, smoking and drinking, that invested a bunch of time and effort into changing their diet, going to gym, hitting the sauna, taking the supplements, and now getting healthy. And there's specific metrics that, one is physical, one is visual, the other one is your energy, right? And you can have these wearables that can track all of these things, and specific blood tests that you can measure before and after. Well, here at the White Clinic, we actually do longevity dentistry. Biohacking your teeth is something you can do. And I would argue that depending on the demographic that you're in, let's say you've got amazing teeth, you're, a Gen Z, you've got everything fine. Probably what you'll need is to have a healthy microbiome, fluoride-free toothpaste, visit your dentist regularly, have a good arch. You might need some orthodontics because depending on the shape of your arch, if you have a narrow arch, your breathing is going to be affected. If you have a wider arch, you'll be breathing more. Nasal breathing is very important in that, chewing hard foods when you're growing up. Let's say now you're a late millennial or Gen Z and you've got these old dental treatments and you want to upgrade. I would argue metal-free dentistry is best. Not everybody is compatible with metals in their mouth. There are blood tests you can take to actually see if you are intolerant to certain metals. Many people don't know about that, but we're working with labs for over a decade now where you can run a blood test to see if you are hypersensitive to metal. So imagine you don't want to spend the money. Do the test. Get tested. If you're compatible, you don't need to change it. Also, you can test your hair for trace minerals to actually see if you have heavy metals inside your body, deeply deposited from a lot of the toxins that can be found, such as the mercury. And you can, if you change your mercury fillings following the SMART protocol, which is a safe mercury amalgam removal technique established almost 30 years ago in the state, you can actually then do chelation therapy and then measure after about a year, and you can actually see if you've got those toxins out of your body. Last but not least, we do this for almost all of our patients that have old dentistry in their mouths. We can run specific blood tests looking for inflammatory biomarkers. One of them is relatively unknown, called the RANTES, or the CCL5 cytokine. And let's say the level's high. Once you've cleaned up the mouth with specific protocols and done, let's say, a inflammation-free version of dentistry, you can measure after 6 months. And in over 80% of our patients, we can see a dramatic reduction in systemic cytokines after doing this conversion dentistry to a more, to a better immune-friendly version. So there are ways that you can track this in your own body, not just aesthetically.
Yeah, and let's talk a little bit about, obviously there's a lot of biomarker data being shared in the space now. We're all very aware of the data points we can now bring into our lives. Now you're very much focusing on AI, right? So I'm very interested to understand how you're applying AI to your work and how you see this applying out into the wider industry.
I'm a big fan of AI. I'm a vice president of the Digital Dentistry Society, founded a decade ago, and we meet regularly every year with the greatest minds coming together, talking about robotics, AI, and digital technologies, software. And I mean, dentistry is really rapidly jumping onto that AI bandwagon. And I actually founded a company called Missing Link about a year ago or 2 years ago that looks at panoramic x-rays for potential sources of inflammation. Now, as a dentist, I don't want to take the diagnostics capacity away from a dentist. I think the dentist is sovereign in that. The second that we say an AI can do a full-on diagnosis, that's opening a landscape I don't want to navigate right now. I think a dentist, but here's the caveat. If you are trying to diagnose a complex oral issue as a dentist, so you, the patient, here's a tool that your listeners can take home right now. If that dentist is only using the little film x-rays to diagnose your mouth, and you have a health condition that you think can be tied to your mouth, change dentist. I'm telling you right now, if you have a condition, an autoimmune condition, any problem, and you think it could be associated to your mouth, that dentist has to use CT scan or CBCT. They're ubiquitous. They're all over the place. They're very low radiation, these new ones. And AI can look at that and help find things that the naked eye might not find. And I think that is incredibly, incredibly interesting. And moreover, it levels a playing field. Even on ChatGPT today, if you upload a panoramic x-ray, which is a full mouth x-ray, and say, what do you see here? If you think like a, world-class dentist, what problems could you find here? Even uploading a simple panoramic x-ray, which is a full mouth x-ray, which you can find at any good dentist, before you go visit a new dentist, you'll be surprised at how much information is in that.
Wow.
But naturally, only a dentist, a well-trained dentist with some experience that works with the team, using a CT scan can actually give you a comprehensive diagnostics. And we like to back that up with blood tests and a bunch of other metrics. We cross the field. So we speak to doctors. We think integratively. We're thinking mouth-body connection here to give a full mouth and a full body analysis here. Because, for example, I'll give you one example. A lot of people talk about TMJ, right? Oh, I have TMJ, which is a grinding issue, and you have articulation. That's a symptom. That's not a pathology.
Okay.
And it's a symptom of something bigger, and we need to look at the root cause of these problems as integrative healers nowadays.
Great. Well, of course, AI is playing a big part in so many industries now. And let's maybe just correlate what you're doing in dentistry with longevity. I mean, how do you see these coming together? I mean, we talked about a lot of very interesting things today, but of course, longevity is really picking up in the agenda now, right? People are really starting to think about their health span. They're probably, as you say, they're not bringing the two together, their dentistry with their health span. How do you see this moving now as a integration of the, if you have a conference, right? Let's say there's a conference, you've got the clinical people there. There's no dentists on the agenda, right, at the moment. So how do you see these groups coming together?
Well, I'm actually giving a TED talk next month here in Lisbon, an English one, and my title is Biohacking Your Teeth, How Your Teeth Are Connected to Longevity.
Right.
So I'm a big fan of biotechnologies and of the biohacking spectrum. So let's say you've got affordable, free biohacking, cold plunging, grounding, eating healthy, sleeping, meditation, hydration, all of that. But then you've got your high-tech biohacking technologies, such as hyperbaric oxygen, infrared light, hydrogen inhalation technologies, pulse electromagnetic frequency. We have those in the White Clinic. Now, what am I talking about? We've gone and leveraged all of these amazing biotechnologies, these biohacking technologies that are cryotherapy. We have cryotherapy technology in the clinic. Why? Because you take a tooth out, you're going to have an exothermic reaction, you're going to have some swelling, and for 100 years we've been putting ice on that. So we reached out to one of the top tech companies in Finland that makes cryotherapy, and we're using specific cryotherapy technology to help our patients mitigate inflammation. We're using hyperbaric oxygen chambers in the clinic. So you don't have to go to a longevity clinic to do hyperbaric, and we've got that in the clinic. So what we're doing is stacking technologies and already ready, available, and understood longevity tools. So genetic testing, blood testing, profiling. We're using AI to help us with our comprehensive dental diagnostics. We're making sure we've got the best biomaterials in the world, metal-free, BPA-free, all of that patients can also go online and prove this is happening because they're the end user. And then we're using all of the sequencing of the best technologies to accelerate healing, to reduce inflammation, and mitochondrial output. So nutraceutical, supplementation, all of that. If you're taking a tooth out, Phil, the number one surgery on the earth is a tooth extraction. It's not appendix. It's not boob jobs. It's not plastic surgery. It's a tooth extraction because you are doing an orthopedic surgery. You're taking a tooth out, but that's technically in the bone, in the skull. And you have a gaping hole of exposed bone of your skull into the saliva. If that healing doesn't go well, you will have ongoing inflammation for almost the rest of your life called a cavitation. If your vitamin D levels are low, you're going to have a bad healing. So we know that in longevity. How many dentists out there watching this podcast today measure vitamin D before a tooth extraction? I can guarantee you the number is under 5%. How many of the patients demand or subjective, ask their dentist to say, could you measure my vitamin D? They don't know they have to. So I think the time has come where consumers also have to be smarter. And I think it's an amazing time for healthcare right now, because how can we boost your immune system using the biohacking, longevity, and wellness upgrade that's happened in civilization, thanks to many times like podcasters like yours, to get you healthier while you're having your dental treatment done? And then how is that going to impact your longevity? And Phil, I can tell you, if dentists get this right and do full mouth, really comprehensive, great dentistry with low impact anti-inflammatory protocols, removing all of that low-grade chronic inflammation, the overall impact in health span and lifespan is unbelievable. And it's measurable. And it's measurable.
I love it. I mean, my mind has opened already today. But this is what I love about meeting experts like yourself. You know, I'm an N of one, right? So I'm thinking, okay, I've got to get a proper CT scan. I don't want any of those x-rays. I've got to get my dental work worked out. And of course, this is just a starting ramp to obviously all the great work that you're doing. And I understand that you're working with, big celebs for like, Ronaldo and Madonna as well, right? So presumably, with all this great innovative work you're doing, that's why you're attracting these people.
Well, it's a blessing to be able to. I mean, I live in Portugal. I don't live in New York or LA, and I think ethics is also very overlooked in healthcare. I also hope that AI can help consumers understand that their doctors are ethically guided by science and proven evidence-based protocols, not marketing-based protocols. Everybody wants to make a good living out there, but it can't be at the expense of the patient's ignorance. So I think doctors, above and beyond everything, have to be teachers. We have to be a lighthouse. We can't just be, we're in this for profit. That has to come as a result. So any celebrities or, everybody's the same. We all have a heartbeat. We all die. We all poop. We all have problems. And so luckily as doctors, we treat humans, and some are amazing. But the truth of the matter is, we need to see a change in the public perception of how important poor quality dentistry is in your health span and lifespan. And since it's so damn expensive, I'll give you an example. Footballers, you'd be surprised. A lot of these footballers that make it to the Premier League, and I treat a lot of footballers, these guys, let's say they come from very impoverished families. So their dentistry was done by some local dentist, 10, 15 years ago, because they had high sugar diets. So they had tooth decay by the age of 6 or 7. And I catch these guys now, they're making millions, and you'd be like, how is this even possible? And they don't even know. And you'd be surprised at how many of these big clubs, and I lectured for FIFA online last month, the FIFA that owns football. And thankfully, they're now also aware of the impact of poor quality dentistry on their athletes. And, think about it this way. You upgrade your iPhone, your smartphone. Sorry, I don't mean to brand something there. You upgrade your smartphone. People upgrade their cars every 5-6 years. You upgrade your clothing. Why are no one upgrading their dentistry? How come you have a filling done 30 years ago or root canal done 50 years ago, and it's still okay because it doesn't hurt you, and the guy who did it or the lady who did it was very nice? So, being nice, it's great, but dentistry actually runs out. It has a statute of limitations. I'm using the wrong word there. But studies out of many, many universities will show that a root canal has a 5 to 15 year time span where it actually can offer you the protection of a good root canal.
Yeah.
Unlike a lot of these, biohacker, let's say influencer dentists, I'm not anti-root canal. I'm anti-bad root canal. And quite frankly, a bad root canal can be objectively seen on a CT scan. And we don't need to be fear-mongering all of this. And I'm not saying that, the best thing is to brush your teeth, have a healthy diet, visit your dentist regularly. But we need to really look into the impact of poor quality dentistry in our systemic overall look of health span, because no one's looking into this, Phil.
Yeah, no, I get it. I mean, as they say, a mind once expanded by a new idea never returns to its original size, right? And I've definitely had a mind-expanding experience talking with you today, Miguel.
Man.
Yeah, great. Well, listen, let's do some quick-fire questions, if that's okay, just because I think that people like sort of one-sentence answers now. I know you've got a lot to say, but
let's go.
What would you do on a global policy basis to improve oral health worldwide?
Every adult after the age of 21 should get a CT scan of their mouth or a full mouth panoramic at least once in their lifetime.
Okay. And what about AI? How do you see AI reshaping the industry?
AI needs to be embraced. It needs to be benignly programmed. I think you'll have several AIs working in tandem with each other, but I see it as a very positive impact, leveling the playing field so that patients can make smarter decisions about their healthcare.
And what would you say is the most significant misconception that people have about the link between oral health and longevity?
That teeth are there just for beauty. Your teeth. So if you had to choose between a beautiful smile and a healthy smile, choose a healthy smile any day of the week. It affects your brain, your body, your energy levels, and poor quality dentistry can really, really affect your life.
Great. Well, Miguel, thank you so much for joining us today. I mean, it's been absolutely fascinating, I have to say. So obviously, you've got a lot to say, Miguel, and we obviously have a lot of readership now. So I guess getting people to your website is very important so they can understand how to prioritize the preventive care for their health span and likewise their dentistry. So thanks again. And I guess that we need to make sure they go to your website. So what would that be?
MiguelStanley.com is my personal website. It's the easiest way to find out everything that I'm doing. Also, where I'll be lecturing next. I lecture all over the world on my work, mostly for dentists. I love educating, and my clinic is whiteclinic.pt for Portugal. That's where I live.
Perfect. Well, Miguel, it's such a pleasure, and I'm looking forward to the reactions that our audience are going to have to this. I think you've stimulated a lot of discussion and debate today.
Thank you, Phil. Thank you for your work.